Everybody, it's Dr. Linda of the Vascular Birthmarks Foundation coming to you live from New York City. Today, we have the honor of having Dr. Gregory Levitin with us. Say hi, Dr. Levitin.
Hi, everybody.
He is one of our international vascular anomalies experts. As you can see, we also have him as the expert of the week this week. And we are here for 1 hour to answer all of your questions regarding the diagnosis and treatment of Port Weinstein's and infantile hemangiomas. And we can take just about any questions. If we can't answer them, we'll refer you to someone who can. I am just going to check my phone here to see where I see us live on my phone, because I do see us live on my laptop. So give me a second to check in, and I am not seeing it. Okay, so I see 5 people are on. I just don't know why I'm not seeing it on my phone. Let me get back in. Oh, there we are. I know it's working. I just forgot to turn my, there we go. All right. Now we are there. Kristen, Canary, Jody, Boggins, and 3 other people are watching. Hi, everybody. I usually have to tell you all to say hi, but Facebook changed some settings, so I'm just catching up. I am here with Dr. Levitin. Now, Dr. Levitin, tell us about your 2 practices.
So I am based full-time in New York City, where I have a practice in Midtown Manhattan, and I also have a part-time office in Los Angeles. And so I take emails from patients from all over, and for patients that live or work on the West Coast, we coordinate our clinics and our treatments in Beverly Hills, inside Los Angeles.
Great, thank you. We have Kristen Kinnery saying hi. Ashley Hedricks is watching. Pat saying Pat Levitin. Is that a relation of yours?
I've heard her. I think that's my mother.
She's saying it's not on the laptop, but it's on the iPhone. But we're on the laptop, so that's strange.
Yeah.
We'll see. Hopefully, maybe some other people.
Hi, Ava.
I had to log out and log back in. So, hi, Mrs. Levitin, and hi, Ava. So, he goes back and forth between New York and California, which is great. He is one of the experts that's always at our conference, aka Super Clinic. Oh, I see some hi, Gina is saying hi.
Nayli from California.
Yes.
We got the West Coast represented.
Yay, great. So we are seeing some movement over there.
And across the Atlantic in Scotland. Hi, Sarah. Thanks for checking in.
Oh, yes. Oh, hi from Scotland. Hi. So we have 1 hour to answer your questions. No questions are too difficult. We will figure them out. If we can't, we'll have you send them to one of our other experts. And if those of you coming to our Super Clinic October 7th and 8th in California, Dr. Levitin will be there along with Dr. Nelson, Dr. Coletti, Dr. Wayner. The whole team will be there. So we hope to see you all, and registrations are open. Hi, Zach from Ohio. Hi, Maria. So we have a lot of people. We have 23 of you on. Hi, Tatum from Canada. We're ready to take your questions. Go ahead. Let us go forth and answer your questions. It's been great because it's been a year since we did our last Facebook Live.
Yeah.
And with COVID, and now we're back actually in person. We're not on a split screen.
That's right. We did a Zoom call or something last
Yeah,
time.
we had to do Zoom. We've been doing Zoom, so I've only recently been able to be in person. Hi, Rosie from Oregon.
Well, actually, Linda and I were talking today. Thank you, everyone, for getting on. COVID's not over, but we're in a COVID-safe mode, which means this is a great time for people with birthmarks who may have put things off for a while, or maybe had things scheduled that had to be canceled during the crazy time of 2020. But I can tell you, for the last 6 months, we're back to full speed here. Our hospital has been incredibly supportive, getting our patients scheduled, and obviously insurances, took a break for a while, but they're also covering our treatments again, and so we're really excited to have our patients back. And I think a lot of people are seeing the differences now, getting back to treatment.
Thank you for that. We have our first question. Arian Price. Her son has a venous malformation on his lip and in his cheek area. I know you've treated a number of those.
Yeah.
She doesn't say anything other than that, but maybe you want to address how you treat those.
Sure. So venous malformations are often misdiagnosed in children as hemangiomas because sometimes they may look swollen like a hemangioma. But unlike a hemangioma, venous malformations continue to progress because they're a vascular malformation. So oftentimes as a child grows, it grows with them or sometimes grows faster than them. And venous malformations look blue. So bluish, discolorations are very different than the dark pink or red marks of port wine stains and hemangiomas. But the good news is that venous malformations in the mouth on the mucosa are very easily treated with a YAG laser. And it takes more than one YAG laser, but it can actually make a big difference and reduce it, shrink it, and actually stabilize it for a while. The same YAG treatment can also be done on the skin if there's a bluish skin discoloration of the cheek or the face. And again, these are safe treatments that we've been doing for 15, 20 years now. And again, usually 2 or 3 treatments is what it takes to put things back in check. I also tell people, doing nothing carries its own risk because, again, these things progress and they continue to grow. So it's not always safe just to let them, watch it for several years, but in fact being slightly proactive or preventative can actually minimize the need for more invasive treatments later on. And then again, for some of those children who go through puberty, and maybe that's when, a vascular malformation appears, those are also opportunities to also intervene early on to prevent the progression further.
Great. Kristen Kinnery, I'm just going to recommend we have 2 papers on our website. And yes, there is a correlation between hemangiomas and placentas. A study done by Dr. Carmen Barnes matched the genoming sequencing 100%. And a survey that VBF did in 1995 indicated 85% of the moms that had an infant with a hemangioma had a placental abnormality. So you can read about that correlation on our website. Aaron Price has a question from the Wales. His son has a venous malformation. Okay, he has had 10, this is a follow-up, 10 sclerotherapies, but with COVID, they haven't had any operations for 2 years. He is now 6.
So obviously a picture tells the whole story, but I would say if you had sclerotherapy, it sounds like there's some deeper components to this. I think after 10 scleros, you might want to reevaluate with a new MRI, see what the lay of the land is, see the full extent of the malformation. You can also email me. I'm one of the listed doctors on the Vascular Birthmark Foundation website. You can share some photos, some questions, and again, once I see the photos, I could probably offer more definitive advice to help you out.
That's great. Samantha said, my daughter has an infantile hemangioma on the left side of her scalp and her shoulder. What causes hemangiomas?
I wish I had the perfect answer for the perfect question. What causes hemangiomas? Essentially, we still are discovering what causes hemangiomas, what causes them to grow, why some grow small, why some grow large. But we really don't know exactly why. Over the last 15 years, we've thought about placental cells, we've thought about stem cells, and I think one day a very smart person will stumble across the answer. For now, what we're fortunate to have is propranolol or hemangiol therapy. So for any proliferating or growing hemangioma, please reach out to a vascular birthmark specialist as early as possible, because laser and oral propranolol therapy can make a world of difference in a growing hemangioma. But there's really a window of opportunity in those first 3 to 6 months to make the biggest difference.
True. Zachariah, he's asking, it's more of a curiosity. So he's talking about during his wife's pregnancy, she had the vaccines and her baby was born with Sturge-Weber. The answer is we don't know. Nobody knows.
Yeah, I would not try to make cause and effects that way.
Right.
I mean, it's nice, it's called true unrelated. I think if there was truly a cause and effect from COVID vaccines, given the millions of people that have had vaccines, we would have seen some of those cases pop up by now. But we do know that these cases happen often 1 in 2,500. So while not very common, these are still things that we see often enough. So I think that's just the nature of what happened.
The statistical probability of 0.03% of the population being born with a port wine. And of those, a good percentage, 30 to 50%, will have Sturge-Weber. Allison from Texas says, my son has a hemangioma, as does my niece. Is there a genetic connection, anything we can do to reduce the chances of future children getting hemangiomas?
Yeah. So 1 in 10 children are born with a hemangioma birthmark. Fortunately, the majority of these are not clinically significant, although the ones that occur on the head and neck are the most likely to become clinically significant, although anywhere on the body can. But no, it's just the nature of genetic randomness that these things occur in the first place. And I always tell people with a child with a hemangioma, there's no greater risk for a second child or niece or nephew or anything for that matter.
That's great. We have a lot of people in my family, including my daughter, which is why VBF was started. So we call them familial, because there are like 5 people in my family, and statistical probability, who knows? I can't say the first name, so I'll say Ms. Anastasi has a 6-year-old with a port wine from the buttock to the toes on the side of his right leg. No difference in length or width. Could he still have KTS?
So the answer is it's possible, but if it hasn't shown up in a discordance at age 6, that's a fortunate thing. Obviously, puberty will show any other further changes, and if it's a relatively same-sized leg, then I think what you have to worry about is just the port wine stain, and those are hard to treat in gravity-dependent areas. But keep an eye on it, and certainly try to keep an eye out for any changes.
Thank you for that. So Tara Nesman says she recently had surgery on her face, lips, and neck. The side without the birthmark healed fine. The side where she's had 14 laser treatments struggled to heal. Skin that was approximated died and has now sloughed off after 2.5 months. So here's my question. Does the laser compromise blood flow to tissue with port wine and cause these surgical complications?
So what you're describing is venous congestion, and so when you treat port wine skin, it definitely heals with greater swelling and reduced blood flow. And so depending upon the incisions, depending upon how the blood flaps were repaired, some of that surrounding skin of the incision is at risk. In non-smokers, most of the time that's not a problem, but even in the best case scenario, that can sometimes have what's called incisional necrosis or sloughing of the skin, as you said. The good news is it's very superficial typically, and it heals quite well. Just takes a lot longer to heal than the other side, as you described. So keep it clean. Use Neosporin or bacitracin. Follow up with your surgeon regularly so they can observe to make sure there's no infections. And give it time, and by time I mean 3 to 6 months.
Thank you. Naylee says, this is probably more of a preference question, but I'm stuck between staying with Kaiser or going private to treat my daughter's port wine. How do I know if treatment at Kaiser is getting effective? I hear so many stories about mom prefer private, so I'm confused.
So as someone who practices in California and has many patients that reach out, Kaiser is primarily a West Coast insurance. Unfortunately, their vascular birthmark resources are very limited, and most patients have to leave Kaiser to get treatments on a regular basis, and typically have to either pay out of pocket or change their insurance for a couple of years and then switch back, because Kaiser's, again, they have a great network of doctors, but they're not as resourceful for specific specialties such as vascular birthmarks. So it's been a struggle, to say the very least, for my patients who have Kaiser to get coverage.
Thank you. So Tatum says, my daughter was born with 3 hemangiomas. I've heard of moms taking their kids in to check for internal. Is this something I should get checked out since my daughter has more than one? She's now 2 and nothing's bothered her.
Yeah, so in the first 6 months of life, if there's 5 or more, we recommend sometimes doing an ultrasound of the liver to check for internal hemangiomas. At age 2, you have nothing to worry about. You only had 3. I would say as long as those 3 are starting to involute and not causing any significant issues, you're fine.
Great. Maria Drewing says, my daughter is on propranolol for a head hemangioma. We started at 2 months, and now next month she will be 1. Doctors left it up to us when to stop. I don't know when to stop. Any suggestions? It's flat and a very light color, so it's pretty much gone.
I think you've reached the end of the window for treatment of hemangiol or propranolol. It's really for the first 6 to 9 months up to age 10 or 12 months of age, and typically we don't see much of any significance afterwards. So typically you'll wean off within a couple weeks or even stop at that age. And if you see any signs of regrowth, that would be the only reason to go back on the medication for another 6 weeks or so. And then if your scalp hemangioma is flat and it's growing hair, then you probably have not much to worry about. But if a flat hemangioma still is not growing hair and there's a large area, that is something that you should have evaluated for possible surgery, because a bald spot at this age can be a bald spot in 5 years or 25 years, and that's not always something that's easy to treat at a later age.
Thank you. This is an interesting question I've never heard. Can Sturge-Weber syndrome be detected in utero if a sample of the amniotic fluid is taken?
I'm going to defer to Dr. Comey for that, because
Yeah.
that's an interesting concept. I mean, I think Sturge-Weber is a clinical syndrome that we observe in port wine stains that have glaucoma or meningeal involvement. I'm not sure that amniotic fluid would hold any genetic cells or anything that might depict that, but I'd be certainly interested to know if there's any research in that area.
Yeah, so you can email me at vbfpresident@gmail.com, and I can put you in touch with Dr. Comey if you want to ask her directly. And Aaron said, who had already asked you a question, that he'd like to reach out to you by email. You can find Dr. Levitin on our website at birthmark.org/Levitin, or which one do you prefer?
Dr. Levitin at birthmarkcare.com.
Okay.
Or go to www.birthmarkcare.com, and that's my website, where you can fill out a quick little form and reach out to me directly.
Perfect. Thank you. Okay. Lots of people are on. I have an AVM on my front right temporal lobe, and having a craniotomy soon. During my diagnosis, my specialist found I also have RASA1, CMAVM. I can't find much info. My 3 sons all have multiple different red marks and will be tested, but I'm worried about my youngest son, 7, has over 40 marks and more every few months. What can I expect? I think this family should be in touch with Dr. Vicula. Is that what you were thinking too? Yeah, I will. Email me at vbfpresident@gmail.com. I'm going to put you in touch with the leading vascular anomalies geneticist, Dr. Mika Vicula. I think you should talk to him. He'll probably want to.
Yeah, there's a lot of new research and medications specifically related to RASA or PIK3 mutations, and specifically related to vascular malformations. And it starts with a tissue biopsy, but you sound like you have several members in your family which could have genetic components to it. And this would be an important step in evaluating each of these patients to see what the underlying potential cause is.
Thank you. And this is a shout out, Lori Ann. She was somebody whose son had a pyogenic granuloma, and it was spontaneously bleeding like crazy, and everybody's ignoring them because they're small, but they are little buggers. And she just was saying everything's doing great, and she, I'd love to, send me a picture. I want to see how he's looking. She said, I wish you could see how great he's doing. I'm happy to hear that, so send me a picture at vbfpresident@gmail, or just message me on Facebook like we communicated before, and you can let me see a picture. So Andy has a question for Dr. Levitin. My 2-year-old son has a port Weinstein on his left face, and we had 7 PDLs. We noticed very minimal improvement. How many PDLs before we can see a big improvement?
So Dr. Linda and I were just talking about this, and I'll say is there's a lot of us do different settings on our lasers, and sometimes you have to experiment with the settings to find out what is the most effective setting. And some doctors treat at the same settings regardless. That's not to say that anyone's better than anyone, but again, certain settings may give better results than others. And so I'm happy to talk to you directly about that. You can share photos with me, and I'm comfortable to say that sometimes just changing 1 or 2 settings can make all the difference. And if you have not seen improvements after 3 or 4 treatments, you should have that reevaluated for how you're treating it, because you should see improvements after 2 or 3 treatments.
Agreed. Susie Quattro wants to know if an MRI at 14 weeks was inconclusive, then confirmed for Sturge-Weber syndrome, is it worth it in repeating an MRI at 1? That's a Dr. Comey thing, but we do have that in our booklet. If you go to our website at birthmark.org and click on the Sturge-Weber syndrome link image, you'll see our new booklet that I did with Dr. Comey. And what she says is, if there's been seizures, you can have the MRI before 1 and it will show something. But if there's been no seizure, you need to wait until age 1 to have it be conclusive. That's what it, and that's in the book.
A lot of patients have it in the first 6 months of life, but exactly, it comes up again.
Yep. Samantha says, at our last appointment, we had the medication upped as the hemangioma had started growing. is now flat. If we come off of it, what chance will it regrow?
Well, it really depends upon what age it is. Hemangiomas grow for the first 9 or 10 months of life, and then they essentially start slowing out, at that last period. So if your child is already 10 months of age and been on Hemangiomas for more than 3 to 6 months, you probably are safe to stop it. And about 10% will regrow, and then you just go right back on the Hemangiomas for another 6 to 10 weeks and try to come off it again. Typically by age 12 or 13 months, most kids are able to get off of it. And I've said this before, longer is not better. Treating propranolol into the second year of life does not give you more results, or better results for that matter. You really want it just for the window of the proliferation or the growth phase, which is really that first 6 to 9 months of age.
And I've been reading a lot about longer tapers because of the concern that the hard stop was rebounding. Do you typically do what is your protocol? Do you do a 2-week taper, 4 weeks?
Yeah, I'm a 2-week taper because for several reasons. One, it's a cardiac medication you've been treating a normal child with, so I think that there is potential for abrupt stops. And two, as I just mentioned to you, as you're weaning, you're looking for any changes, and that way you can go right back up the ladder if you need to. So the idea is a 2-week taper gives you an opportunity to observe for any signs of regrowth and then reinstate treatment if necessary.
Thank you. Ram says, what are the risks of sclerotherapy with Gliomyosin on a tongue malformation?
So, Gliomyosin is a medication for sclerotherapy of venous malformations that's incredibly safe because it avoids the toxicity that some of the other components like alcohol or some of the other sclerosins have. For the tongue, it's actually very well suited. It just needs to be done in a very controlled or localized way. And so a lot of times it requires someone who's treated the tongue and is able to do so in the operating room where they compress the tongue, holding the sclerosin in contact with the malformation for as long as possible. And that's really the secret or the trick of good sclerosin to the tongue with Gliomyosin is long contact period. And it requires, again, opening up the mouth, compressing the base of tongue, injecting the sclerosin, and holding it there. And sometimes that's a combination of an ENT or oral surgeon with the interventional radiologist at the same time. So you really need a team approach for those.
Kristen has a second question, and her daughter's the one with 55 plus hemangiomas, and she's on propranolol, was on propranolol and timolol. She said she had the ultrasound done, and she did have them internally. Should she go for repeat ultrasounds now that she's off and make sure they're gone?
No, because the clinical signs would have been there already, and the propranolol or Hemangiomas is the treatment for the internal hemangiomas. So you already did everything right, and I don't think you need to go looking for anything at this point. I think it sounds like you have all the information you need. The only thing I would offer or suggest is any residual hemangiomas should be treated with laser and or surgery because this is the window of opportunity again to get the most effect while they're still young and not wait 5 or 6 years and implement treatment at that time.
Thank you. Laurel Lynn Ann says, I have a CMAVM and my daughter has a port wine and she also has a brain AVM, the mother. She's just making a statement, but I know that Dr. Coletti and myself were doing a study on intracranial AVMs with port wine stains. So if you want to email me at VBF president@gmail.com, we're trying to see if there's some link. Let's see. We have Pat Levitin. Can you put your website in the chat? Yes. So, thank you, Pat. So, Delcy, if you could please put Dr. Levitin's website, birthmarkcare.com. Birthmarkcare, one word, birthmarkcare.com. Thank you for that reminder, Mrs. L. Andrea says, my daughter is now 13 months old and has been on propranolol for 12 months. It's a long time. For her segmental hemangioma that covered approximately half her head. She only has small vessels left, not noticeable to someone who didn't even know, but her dermatologist would like to keep her on the medication until she's 18 months and wean then to see if we have any regrowth. Is this course of treatment the norm?
So again, we're talking about at age 12 months, there's really no more improvement that's going to be expected. And so what I would say is you should be evaluated for laser treatment at this time. You didn't mention that, but a lot of times we implement laser treatment concurrently with the propranolol treatment, and you get a much more significant clinical response as opposed to doing one treatment and then waiting around and starting the next one. And so actually I do not think that 6 more months of therapy will give you any further resolution of your segmental hemangioma, but pulse dye laser will make a world of difference. So I encourage you to reach out to either a birthmark specialist or a dermatologist who can offer that to you.
Thank you. So Ati's from the United Kingdom, Manchester, and he says he has a large hemangioma, but he means a port wine because he said he's starting to develop skin tags, but they're probably blebs, and he wants to know what he can do to help the blebs.
So you're describing a vascular malformation, not a hemangioma, but again, as many of these are often misdiagnosed early on. And what Dr. Linda's mentioning is the overgrowth syndrome that happens in a significant portion of port wine stains as we age. And so those are things that are often treated very effectively with local small excisions. Sometimes laser or a YAG laser can help reduce it if it's caught early. But by the time most of these blebs occur, that's a loss of the collagen and again an outgrowth of the vascular tissue. Small excisions can be performed and smooth out the skin, and the incisions are usually very minimal at best.
Thank you. Melanie says, my daughter's been on propranolol since she was 8 weeks old. She has one hemangioma on her cheek and one on her stomach. Do all kids that have hemangiomas on their face require pulse dye laser? Her dermatologist said no, due to it only reaching down 1 millimeter, and there's a risk for ulceration. She's now 4 months, and her face hemangioma is larger in size and more puffy.
So there's so many questions I have for you already right here. One, are you on the right dose of the propranolol if it's still puffy? Number two, remember, propranolol, only about 60% of cases respond to it. 40% of patients don't, meaning despite our best efforts, they still require additional treatments. And I do believe that the laser is effective on the superficial component, and that can often be preparatory or at least help treat the overall surface of the skin, whether it's future surgery to help improve the healing of the skin edges, or even if the propranolol does work and this does flatten, you would obviously want to have the red skin removed as well, so without potential for surgery. But again, you'd have to send some pictures. I'd be glad to offer my 2 cents. I'm not sure where you live, but we can certainly try to help give you some better advice on that.
Thank you. Andy Miguel Tio said, greetings from the Philippines. So thank you for watching. Samantha has another question. The one on her shoulder has gotten lighter, but unlike her head, it's still very noticeable. Does this mean it is not responding to the propranolol?
I'm sorry, back that up one more time.
So she was the one who it went completely flat, but now she's saying there's one on her shoulder that's not flat.
Okay. Again, when propranolol works, it works very well. And if it's not working and you're seeing growth, you have to reevaluate either the dose or admit that this is one of those ones that didn't work. Again, and start considering other therapy, whether it be laser therapy or even a small surgery if necessary, depending upon the age of the child.
Okay, Marianne said her 6-month-old daughter has a port wine on her right cheek, lower lip, and chin. Can her birthmark affect her lip in the future if untreated? By that I mean, could her lip get larger and affect speech?
Yeah, so about 15% of port wine stains grow either during adolescent growth, puberty growth, post-pregnancy growth, or just over time as people age. And those are not predictable, at least not at this time. But we do think that treating with laser is a very healthy component to treating port wine stains. Time will tell whether or not these children who have had aggressive laser treatment in their first 6 years of life will develop port wine stain overgrowth over the next 25 to 50 years. We haven't quite followed all those patients out. But again, I don't think that anyone has a crystal ball at any signs of port wine stain to say which ones grow. And I think the ones that start to grow earlier on are the ones that we have to keep track of and potentially consider earlier treatments, because leaving it alone allows it to continue to grow unchecked, can actually result in more significant deformities that require more significant surgeries.
Thank you. Erin has another question. They're from the UK. Her son's venous malformation was misdiagnosed as a hemangioma when he was 9 months. We hear this all the time. And he was put on propranolol 3 times a day for a year before it was correctly diagnosed. I mean, this happens.
Yeah, there's no harm in it. It just, obviously, it didn't work. Yeah, that's probably what you noticed, that the VM was the same.
Right. Carla says, a special thanks to Dr. Levitin as he answered all the questions I had as a worried mom of a little girl with an oral venous malformation. He was very kind and human. Without even knowing us, he helped and gave us hope and tranquility. Greetings from Peru. Carla Santos.
Thank
Very
you.
nice. Yana says that her daughter had a light port Weinstein on her right side of her face, tiny bit by the eye, which was gone after 10 laser treatments. She's had no evidence of seizures. She's now 18 months. I know chance of Sturge-Weber is 30 to 50%. Do the chances decrease after age 1? What are our chances now statistically?
I think it really is about the distribution of the port wine stain. If the upper eyelid or if there's stain on the eye, on the globe of the eye itself, those are the ones that have higher risk. But lower eyelid or lateral to the eyelid onto the cheek actually has much lower risk of Sturge-Weber. And if you haven't had any signs of seizures, that's a good sign. But I think you would obviously need to follow these patients closely. But it sounds like this is a low-risk case the way you described it.
Thank you. Ahmad Elkaled is from Lebanon, and he says, good evening, Dr. Linda and Dr. Levitin. I love Dr. Levitin, a person of the highest morals. Greetings to you from Lebanon.
Thank you.
Rachel Kissling said, my daughter is 1 and has a port wine all over her body. She has had 23 laser treatments on her face, but none on her body. When is it recommended to start the rest of her body?
So this really depends upon the area that's involved and how extensive it is, and that includes also the shade of the color. Realistically, it takes 6 to 8 treatments to reduce a port wine stain by 50%, and that's the starting point. So if you start from a light port wine stain, you're going to get a very light port wine stain at the end. But if you start with a very dark port wine stain, it'll be lighter. But you're really talking about committing to 9 to 15 treatments over the course of a couple years to make the desired effect. Certain skin responds better than others, and it just also depends upon where that skin is. Thinner skin over the rib cage is much better than the skin over the abdomen or over fatty areas. And extremities and fingers and whatnot are even more difficult because, again, of gravity-dependent areas. Happy to offer my 2 cents if you share any photos.
Thank you. And we are halfway through at 4:31. It's a speedy day with lots of questions, and keep them coming for the next 30 minutes. Jody said, are there specific characteristics to look for to determine if a birthmark is an angel kiss or a port wine stain in a 6-month-old?
So you're describing a midline venular malformation or a stork's bite or angel's kiss. So essentially the ones that occur on the midline of the forehead, along the nose, or around the eyelids is a little bit different than the ones that occur on the back of the neck, which a lot of people have. The ones on the back of the neck tend to persist into older age groups, but the ones on the forehead tend to lighten up over 18 months. How do you know? Well, typically a midline venular malformation or angel's kiss is in a V-shaped on the forehead, whereas a port wine stain typically is half of a dermatome, which means it has a very specific distribution. So if you have it bilaterally in a V stripe or along the midline, that's typically what's called a midline venular malformation. Darker ones, they tend to darken when the child cries or holds their breath or exerts themselves, whereas port wine stains do that minimally. And both of them can be treated with laser. Port wine stains, we definitely recommend early treatment with laser, whereas midline venular malformations typically lighten up over several months. So again, share a picture, I'll share another opinion, but that's what I have to say for now.
Yeah, and it's like you said, if the baby's 6 months, you can look at birth till 6 months, and if it's later, then ride it out and address it if she wants to clean it up with a little laser, right?
Yeah, well, midline venular malformation, it only takes 1, maybe 2 lasers and it's cured.
That's amazing.
Whereas port wine stains, again, we're talking 3 to 6 treatments in the first year or a year and a half.
So Miss Anastasia has one more question. Her son is 6 and he's had laser on his face, but only 3 on his leg, and she wants to know, they stopped it because they chose not to use GA, general anesthesia, so should she restart now? And
again, you're not going to get a desired effect on the extremities. It's very frustrating because it takes so many treatments on the extremities to get any significant improvement, and then it just comes back over the next couple years. So it's really a trade-off, or at least set your expectations correctly for that. That's not an easy decision to make.
So Andrea's back, and she was just saying she asked her derm today about laser treatment, and he said to come back when she's ready for school. Her nearest hospital that has laser is Toronto. Sick kids at 16 hours. Well, guess what? Dr. Geronimus in New York City has a VBF plan, and we have a flat fee of $500, and anybody can come from anywhere in the world and get as many laser treatments as they want with Dr. Geronimus. So if you want more information on that, you can email me at vbfpresident@gmail.com.
And also, I also have a laser in the office too. I'm happy to again work with my Canadian patients as I do now, because again, Canada is very tough to get into see treatment, to get access to treatment, and get approved for treatment. And so, we also want to make that affordable. And again, it requires multiple treatments, so we can do that. If you can do it in the office and avoid a hospital fee or general anesthesia fee, we can offer a lot of discounts as well.
So you treat patients from Canada even though they don't have the U.S. health care?
Well, that's what I'm saying is they don't have coverage. So
okay,
we charge
so you work to negotiate.
Yeah, exactly.
Okay, that's good to know. Natalie Welch, my 2-month-old is currently receiving PDL treatment for a port wine on his cheek and upper lip. Would oral involvement of the gums be evident at this time? What is the likelihood it will develop? So he's 2 months.
Yeah, I mean, those are great questions because you're really talking about the overgrowth syndrome. And, one of our colleagues, Dr. David Darrow, is, a true expert in this. You wait and watch and see. Not every port wine stain behaves like another one. I always say no two birthmarks are ever quite alike. And so when you notice some changes, then you need to present yourself to a birthmark specialist. Typically dentists are not going to treat this. But again, we have specialists in our network. Again, I do my own procedures. Dr. Darrow does a lot of these procedures. He's in Virginia. But again, these are all, in this day and age, we're all connected, and we can all find ways to get you connected to the right specialist if and when the time comes.
That's great. Oh, this is great. Stephen Booth said he just had his first PDL treatment that he stopped at 20 years ago, and the results are looking good. We always tell people it's never too late.
Exactly.
Right? Never too late.
Congratulations.
Welcome back. Megan wants to know how many treatments for a port wine stain on the face, left cheek, before you start to notice a difference. Also, how brutal are treatments for an adult? I've never been treated before, but obviously scared just thinking about it.
So people ask me all the time. I have any given month I have like 20 adults that are coming through my office for treatments under local anesthesia. Under local, meaning no anesthesia whatsoever, no creams, no anything like that. It's like getting hairs pulled out one at a time, or a rubber band that snaps on your wrist. It's a sharp sting, and obviously we're treating anywhere from 20 to 60 or 70 spots. So that's a lot of little snaps. But the good news is, a little ice pack afterwards, and it doesn't hurt afterwards. It just hurts in the immediate time. A lot of women describe it as similar to a hair removal laser, things like that. I would say that 95% of my patients tolerate it perfectly well. 5% are just like, please, doc, just give me some anesthesia next time at the hospital. That's really an individual decision. You can go under IV sedation at the hospital for your laser if it's a large surface area that needs to be treated. Or if it's not tolerable or in a sensitive area. But I would say brutal is the wrong word. Uncomfortable, snapping pain, or small like hairs being pulled. That kind of feeling is what you would expect. And you can also do a patch area. You don't have to commit to the whole area being treated. I'd say is commit to starting treatment, and then you decide when you're finished.
Yeah, like a little test spot,
Mm-hmm.
and you could just see how it goes.
Yeah.
That's what we a lot of our doctors do that initially. They just do a test spot. And some doctors will give a zap on you before they even start it, and then let you decide.
Exactly.
Right?
I would say and it's an individual experience. I wouldn't say that, like I said, two people ever experience it the same, and some people tolerate it better than others. But again, you gotta start somewhere with a single step.
Right. So Michelle from the UK said, I'm 44 and have a very large port wine on the side of my face, neck, behind my ear, and my hairline. I've read it can be difficult to remove a birthmark when you're an adult. Can they be removed completely? If you have a very large one, does it take years and years to remove?
Yeah, so larger areas and darker port wine stains, especially ones that have been left alone for a long time, it's just a long walk back. Instead of 3 to 5 treatments, you may be talking about 8 to 10 treatments over a period of time of every 6 to 8 weeks. But I would say is, every 3 to 5 treatments, you're going to see a noticeable change, a significant change, and if it's a highly visible area, you're going to see differences. And again, that last person who just got back on, has already seen improvements after the first treatment. Never too late to start treatment, and I would say is, proof is in the pudding. You either see results or you don't. And again, most of these do respond after 3 or 4 treatments in a noticeable way.
Okay, so Melanie, you should email Dr. Levitin because she has a lot of questions on dosing, ulceration of the hemangioma. She feels she's not getting proper answers. So just email Dr. Levitin. His email is posted, or you can go to his website at birthmarkcare.com. And Steven said, oh, he's communicating. I love it when people meet each other on our Facebook Lives and find out they're from the same area and
really?
they start talking.
Yeah, small world.
Yeah, so they're like texting each other and they're going back and forth. Is it common for kids with port Weinstein to have eczema?
Well, I think eczema is a pretty common disorder to begin with. And again, there's a lot of kids out there with eczema, and I'm sure there's a cross-section with port Weinsteins. I'm not sure that one or the other causes the other, but they definitely can coexist. I've seen it.
Yeah, and Dr. Nelson has talked about this, that he sees some kind of a extraction of oil in the skin of a port Weinstein that makes it more eczema-like, because the port Weinstein with its hypervascular. He talked about it on one of our sessions. So while
eczema,
nobody's calls it eczema, they see like a dry patches.
Well, so yeah, exactly. I think, and that probably has to do with some of the loss of the architecture of the skin that holds onto the moisture. And that's what eczema is. Eczema is basically dry skin. The body's cross-linking doesn't hold onto the natural moisture of the skin. And so emollients like Aquaphor or Vaseline, those type of water-based preparations are really helpful for eczema, but also I'm sure for those dry patches on the port Weinstein as well. Very safe to use.
Yep. Susie Quattro says, what would be the treatment for a port wine that covers 3/4 of the face, including over the eye, gums, and lip? Is there a risk, and how much of the teeth structure being out of sync as a result of treatment?
So the treatment is not that it would make anything worse, but you describe what I often describe as a full thickness port wine stain. So it's not just the stain of the skin, it's the skin, the fat, the muscle, the bone. This is one that's probably at a higher risk for overgrowth syndrome, despite any of your best efforts with laser alone. And so you're going to want to watch that child's development and see if there's any changes to the bony structure or the alteration of the dental areas where the teeth tend to be less slanted or have an open bite deformity from the overgrowth of the maxilla. And these are all treatable conditions, and you tend to time them after the growth phase, of puberty, because you're trying to make a final result on that. As far as what to treat, and again, you're going to try to treat as much of an area like that as possible. That would be something to do under general anesthesia for the comfort of the child, for sure.
Another similar question about anesthesia. She wants to know, Madison wants to know if you suggest children to go under GA when having laser treatment on a facial port wine. Her son has had 4 without it. He's 10 months old, but she's curious as he gets older how hard it will be.
Yeah, and so people have different rules, or consideration. There is no hard, fast rule. I think in general, it would be if you can avoid general anesthesia as much as possible, that's a good idea. Again, for the safety of the child, if it involves the eyelids, for the comfort of the child, if it's a large area, you should definitely consider inhalational anesthesia. It's quick, it's easy, it's safe. I know a lot of research is ongoing about this, about how many anesthetics are safe. As my own personal experience with my own children who've had different ear tubes or surgeries or whatnot, they've each had 3 or 4 anesthetics, and they seem to be doing pretty well so far, I'd say. Ask my mother; she's on here somewhere.
Yeah.
But the point being is, I think in general, if it's larger than the palm of the child's hand, that may be an area that needs to be considered, for treating under anesthesia. But my rule of thumb is if it's an area that's smaller than the palm of the hand, you absolutely can do that safely and comfortably in the office, which is really talking about 10 to 12 spots. Once you get up to 30 or 40 spots and holding a child down, you may want to consider doing partial areas, meaning that you commit yourself to 20 treatments or 25 spots, which is again 25 applications of the laser, and then call it a day and come back another time. And again, even if it's inconvenient to come back, 3 or 4 times, to get the whole area treated, it may be more tolerable, it may be safer and more comfortable for that child. But again, as a way to avoid general anesthesia.
Thank you. Michelle says, I'm 46, never have had laser, and she's developing bumps, blebs. Will laser help with that? And they are bleeding.
So a bleeding bleb has pretty much gone too far, and those tend to need to be removed surgically with these little small surgeries. And I have some, if you go to my website, I think I have some photos on my website where we took out some blebs. and it looks, again, very small, very small incisions, but you just remove those. But I think Dr. Nelson has done a lot of research. We do think that laser is somewhat preventative for port wine stains and preventing blebs, but it's part of that, again, that overgrowth condition where we're not able to control it or quite predict it. So again, you just need to see a specialist, and again, or at least send me some photos, and I'll try to offer some further advice. And it also goes without saying that all these treatments are congenital. These are not cosmetic procedures; these are reconstructive procedures, and so you should really be working with specialists and your insurance that have all of these treatments covered, because these often require multiple treatments, and we're talking about the unfortunate ones who don't have coverage. But for the most part, I'd say 95% of these treatments are covered on the first pass, and the other 5% are often covered on appeal. So never give up. Keep pushing.
Good job. So Susie Quattro says, how should I care for my daughter's port wine on her face? Any specifics on daily routine or SPF?
Yeah, I think sunscreen for sure. I think in general, sun darkens potentially port wine stains more. But more importantly is sun also darkens the natural skin melanin, which blocks the effectiveness of laser. So if you're considering treatment for a port wine stain, you want to do it not after a week's vacation at the beach where you may have had too much sun, but you want to do it during the winter months when you have the least amount of skin tan, because it does, again, the tanning of the skin blocks the effectiveness of the pulse dye laser.
Thank you. Wow, only 15 minutes left. It's been buzzing through.
Mm-hmm.
Kate says, I am 19 with a lymphatic malformation on the right side of my face. I've had sclerotherapy. It looks great, but I still have the pains that travel along the smile nerve. Microcysts, too, risky to treat with sclerosis. Any options? I heard about rapamycin ointment.
Well, again, that's a lot to unpack without seeing an MRI or photos. So I would say is, for the limits of what we're doing today, please reach out to me. I'd be happy to answer your questions. Again, I'm not sure where you live, but we also have a lot of our colleagues across the country that might be able to see you in person. It sounds like you already had some sclerotherapy and some treatment, but it sounds like there's more that could still be done. So please share some photos.
Sorry about that pause. I just saw that it said it paused. Lindsay said, my 17-month-old son has a V3 port wine from cheek up into the scalp, a small patch on the V3 area. We were told to get an MRI after one to rule out Sturge-Weber. He is meeting and exceeding milestones, no signs of seizures. When is the right time to get an MRI? Should we wait until closer to 3 since he will need sedation? Just struggling on when is the right time.
Yeah. So again, no signs of seizures and non-V1 distribution. Again, the cheek and the scalp are not quite the same as the upper eyelid and forehead. So I would say you don't need an MRI at this time, and I would certainly encourage you to do the research and see what your specialists have to say. But I would say if it was, and again, maybe Dr. Comey has things differently. I'm not sure that we're doing every child with a port wine stain getting an MRI. We usually have to have a clinical suspicion or reason to do so. I'm not seeing your photos, but again, V3 means along the cheek and the jaw, not really on the upper eyelid or forehead. So I would say just observe for now.
Agreed. So young Joe said, I have a port wine with a swollen lower lip. I've had it for 18 years and my lower lip keeps getting bigger. I need help. I don't know how to go about it. I guess you need to know where
this
you
is
live.
I'm not sure where you live, but the lower lip is very unfortunately unforgiving with port wine stains. There's a lot of glandular elements in the mucosal part of the lip that overgrow and cause the protrusion of the lip. But fortunately, it's treatable with surgery. Again, I would encourage you to look on my website. There's some photos of some lips that I've done that show you, you can take something that's 2 or 3 times the size of the normal lip and restore it back to normal. It usually takes one big surgery and maybe one small surgery to get it just right. We're really talking about trying to make the lip as symmetric and contour appropriate. And the good news is, typically one surgery will do it. It doesn't typically grow back again after you remove those glandular elements, which is essentially what we're doing, is removing the abnormal tissue, preserving the muscle and the show of the vermilion lip, and then restoring it back together. So I would say, that's a surgical case, and please reach out to me. I'd be happy to help offer some further advice.
And his website is in the discussion chat, but it is birthmarkcare.com. You can email him through there and also look at a lot of the awesome before and after pictures. Kalani Burbank says, my entire body on the left side seems to be affected. Now we found a hemangioma under my right kneecap that wraps around my main artery. Doctor is worried it could cut circulation to my leg.
So this is a vascular malformation to be determined later, meaning that you need an MRI with and without contrast, possibly MRA with and without contrast. So you mentioned some vessels are involved. I would see either a vascular surgeon or at the very least an orthopedic surgeon to get the MRI or MRA evaluated, and then potentially sclerotherapy would be the appropriate thing if it's underneath the kneecap for something like this. But you would need more information and an appropriate diagnosis before you consider any treatment.
Thank you. This is actually a good one for you to discuss. Tennille's son has a subglottic, or child has a subglottic hemangioma. They just started treatment, want to know how long it takes to be effective, but those are tricky, aren't they?
They are, and this goes back to the no two are ever quite the same. So a subglottic hemangioma typically, is usually a V3 distribution. I mean, you usually have a skin involvement along the jawline, because those are called beard distributions. Very commonly can occur with a subglottic hemangioma. Subglottic hemangiomas occur below the vocal cords, and in a young child can compromise the airway and give them a very unusual cough or respiratory distress. But the good news is they do respond to oral propranolol therapy. And so if you're started on propranolol therapy, you want to get up to 3 milligrams per kilogram per day as quickly as possible. And within 48 hours up to a week, you should see a significant improvement. Now, sometimes these are growing so quickly that there needs to be an intervention done first, and that would be through a pediatric ENT doctor. And sometimes they literally inject these with steroids and then keep intubated for 24 hours and then extubate, because the steroids work extremely quickly, giving just enough time for that oral propranolol to do its thing. And that's usually a combination of two treatments, one in the operating room and one oral. But if you catch it early enough, if you have suspicion of subglottic hemangiomas and you're not in respiratory distress, you're going to see improvements in that first week, especially once you get to that 3 milligrams per kilogram per day. And so you just want to be watched closely, because you don't want to wish it well, and you want to look for any signs of any respiratory distress, difficulty breathing while eating or sleeping, things like that.
Very important. Oh, Imad, you'll be in great hands. He said in June he'll be seeing Dr. Coletti. So he'll be in good hands. So Michelle Rod Room says, thank you. Can you recommend the best person to go to in the UK area?
I don't have someone in the UK that I know that does surgery for vascular birthmarks or malformations. I know, Sick Kids on Great Ormond Street has, a lot of specialists. So I would start there.
Right, Gosh has the leading program there. The Great Ormond Street?
Great Ormond Street.
Great Ormond Street Hospital. Madison Markowitz says, I have one more question. Both of the dermatologists we've seen have been comfortable treating into my son's eyebrow. Do you treat the hairline or the eyebrow with the laser?
So I just found out that not everyone treats the hair-bearing skins. I treat all hair-bearing skins, but what I do is I treat them with a gel, or I have a conducting gel that I use that coats the hair skin, and then I just laser right over the gel, and that gel seems to protect the hair, but allows the penetration of the laser to the vascular stain. And I lose less than 10% of hair when I do so, and not in a noticeable way. And I've had success doing it for the last 15 years, so I'd say that's a very important area not to avoid, because otherwise you end up having an incredibly good response on the normal skin and these very dark red flare-ups along the hairlines or the eyebrows.
It's really good to know.
Really, again, I'm happy to answer any questions from any dermatologists who maybe have those kind of questions as well.
A lot of laser experts I don't think even know that or do that, because I see a lot of red eyebrows and a lot of red beard areas. Can you see the depth of the port Weinstein with an MRI?
So again, port Weinsteins are full thickness lesions, so yes, for overgrowth syndromes you can, but the specific skin you cannot.
Okay, thank you for that. And we have 7 minutes left. Brandy says, my daughter is starting treatment in the next few weeks. She's 8 months, has a port wine that covers her upper and lower eyelids, part of her scalp, most of the side of her face. They said 3 to 4 treatments under GA. Is it likely that it will bruise? Will she have difficulty opening or using her eye after the procedure?
Yes to all the above. And what I mean by that is the treatments will be performed under general anesthesia. They'll need to put in eye shields to protect the eye while they treat the upper and lower eyelids. And afterwards, there is swelling of the eyelids for 2 or 3 days, which means that it will temporarily swell her eyelids, but she will be able to open them and see. She'll look a lot worse than she feels, You can do ice packs if she tolerates it, or at least cold packs, to the eyelids immediately afterwards can sometimes minimize the swelling. And the bruising is natural. In fact, you want to see bruising after laser because that's what it clots the blood vessels and it reduces the vasculature. If you don't see bruising afterwards, or if it washes away too quickly, unfortunately, that means it probably didn't work very well. But that's the idea, that you do want to see bruising after the appropriate delivery of the laser.
As I always say, the post-laser is always worse on the parents than the child. The kid just wants an ice cream if they haven't eaten or something to eat.
Yeah, or even the first few days. Again, it looks worse than than they feel. Again, their kids are great. They're very resilient.
Rachel says her daughter, as 13 months old, still has no teeth, and she does have port wine on her gums, and she wants to know if that's a reason that the teeth have not come in.
No, I think children go through different developmental cycles. I would expect, unless there's a congenital loss of teeth, which is extremely rare and less likely, just give it time.
Okay. Oh, if you see on the bone, does that mean there will be deformities facially?
So I think you're asking is for port wine stain overgrowth, if there's enlargement on one side of the face than the other. By the very nature of port wine stains, there's more vascular inflow to that area, so you tend to see engorgement or enlargement of that side of the face in general. I'm not sure that you could predict how much would be enlarged over time, but yes, if you're starting to see asymmetries, some of those asymmetries are going to be present, but at a very small or low level, versus an aggressive one or an overgrowth syndrome where you're seeing a much greater overgrowth. So again, you just got to, what you see is what you get. You can't really predict these things.
Thank you. Michelle's daughter was on a beta blocker for 9 months, and she stopped it a year ago. Most of the hemangioma is reduced, but there are some thick spots. Will she need more treatments on her lower leg?
I think you're describing a segmental hemangioma if you're on propranolol, which may have stopped the growth. Ideally would have resolved a lot of the growth, but again, goes back to saying is, laser and hemangiol or propranolol work together much better than doing propranolol and then waiting to do laser. So at this point, you just need to do laser, and laser will make a big difference on extremity hemangiomas, for sure.
Yes, Susan, we don't review questions beforehand. Susan Newman, because this is live. I'm not sure what your question was about muscle weakness and the possibility of stem cell treatment. So if you want to email me at vbfpresident@gmail.com, I will look into that for you. And it looks like it is 4:57. I do not think we have missed any. There was one question that came in, and I'm not sure what the language is. But whoever you are, please use the Google Translator, and you can email.
Es en español. Hola, soy de Chile. Mi hija tiene 6 años y tiene un okay. Where's that? Right there. Back up. Yeah. Right there. So in Chile, you're asking is is there availability of laser treatment there for a port wine stain of the face? And so unfortunately, you got to really look hard.
She does the treatment.
Oh, she does do the treatment. Yeah.
Yes.
So again, I don't know every doctor in the world that does treatment, but I always say is every country has a pulse dye laser. You just got to go find it. Right. And so if you go onto your local community boards or Facebook boards, you can usually find other people who have already dealt with this before. And so you pay it forward and you share, oh, I know Dr. So-and-so in Santiago or wherever it may be that has the laser. So great. I always say that I have the same laser that they have. So there's nothing magic about the laser. It's just about finding someone that knows the right settings. And if anyone has a doctor that has a laser and is not sure what settings, that doctor can email me as well. I share my recipe book all the time and tell people, send me a photo and I'll tell you what settings I would use for those lasers.
And she's saying that the child also has a malformation on his cheek, so maybe she should get imaging and have you take a look at it.
MRI and send a photo so I can kind of see what you're talking about.
Great. Well, guess what, everybody? It is close to closing time, and it has been a great session. I see we really caught up with all of the last questions, and if you have any additional questions, feel free to email them directly to Dr. Levitin at birthmarkcare.com is his website. You can see before and after. Do you post your schedule on there when you'll be in California?
I do.
So that's also very important.
I can announce, I think it's June 16th is my next visit to Los Angeles. And so basically, we people email me in advance because we kind of do an online consultation in advance. And if you need treatment, we authorize it with your insurance in advance, so we both